Hi, my name is Erica St.Lawrence, and I am a current PGY3 in internal medicine at DMC Huron Valley Sinai Hospital. Today I will be presenting my case report entitled A Rare Case of Colorectal Primary Signet Cell Carcinoma in an Otherwise Healthy 24-year-old. Signet ring cell carcinoma is a rare tumor that occurs most commonly in the stomach. Primary signet ring cell of the colon and rectum is exceedingly rare with an incidence of less than 1%. If identified, primary signet ring cell carcinoma of the colon and rectum has a poor prognosis due to its vague and often late presentation of symptoms. Although there is limited data on primary signet ring cell carcinoma of the colon and rectum, a retrospective study showed that it tends to occur in younger adults and carries a median survival of 33 months after diagnosis. Our case report. A seemingly healthy 24-year-old male with no significant past medical history presented to the hospital for complaints of progressive abdominal pain, anorexia, weight loss, and intermittent non-bloody, non-bilious emesis for approximately 2 months' time. The patient initially reported symptoms of abdominal discomfort that started 5 months prior to presentation. He attempted dietary modifications to manage his symptoms without success. His symptoms continued to progressively worsen, and he noticed changes in his bowel habits, including looser stools, nausea, and transient, moderate to severe 7 out of 10 right-sided abdominal pain that he described as feeling like, quote, severe bloating and gas, end quote. On presentation, initial labs were grossly unremarkable, but a CT abdomen showed evidence of a partial bowel obstruction in the transverse colon, as well as multiple enlarged mesenteric lymph nodes concerning for malignancy. The patient was admitted to the hospital and underwent a colonoscopy with biopsy of the lesion responsible for the partial SBO. The pathology returned as poorly differentiated signet ring cell carcinoma. The patient subsequently underwent an exploratory laparotomy with ultimate right hemicolectomy and resection of the 8 by 7 centimeter tumor and multiple mesenteric lymph nodes. This case highlights the typical presentation of signet ring cell carcinoma. In particular, presenting symptoms can often be vague, and the patient population of this neoplasm is found in is typically young adult males. Primary signet ring cell carcinoma of the colon and rectum can often be written off as IBS or initially misdiagnosed. However, due to its aggressive nature, advanced stage at diagnosis, and propensity to metastasize, young men with abdominal pain and changes in bowel habits should be taken seriously. This case further highlights that more research and case reports need to be written on this subject. That concludes my case report for primary signet ring cell carcinoma of the colon. Thank you for listening.